So the study that I'm working on is still in its infancy, and I've decided to use this time just to raise some important questions about the place for child development and child mental health in the global health arena. Over the past 2 decades, there has been a 22% reduction in mortality rates of children under the age of 5 in lower and middle income countries. This reduction is related to global programs that have aimed to eradicate or ameliorate the effects of HIV/AIDS, tuberculosis, malaria, and malnutrition, among other conditions. Although this mortality reduction falls below the target set by the United Nations Millennium Development Goals, the societal changes are already profound and will only accelerate in the coming years. There is a growing recognition that the same social environments that have a negative effect on mortality and survival, also tend to increase neurodevelopmental and neuropsychiatric conditions among survivors. Within this increasing survivor group, it is estimated that more than 200 million children suffer from developmental delay or disability. In order to address the needs of this emerging population, a population that will only grow as mortality rates continue to decline, a global strategy focused on early identification and intervention with evidence-based treatment modalities is required. Without such action, the very children whose lives we save will experience little promise of the future. In order to achieve this aim, there is a need for reliable and valid data on which to base health policy and planning decisions. Currently, there are a paucity of well-designed studies which have resulted in a wide range of prevalence estimates for neurodevelopmental and neuropsychiatric disorders in children in lower and middle income countries. This is a result of a previous lack of focus in this area, heterogeneity in methodological approaches, a lack of biological markers, as well as unanswered questions regarding the influence of culture on both the presentation and measurement of these disorders. There is a need for multinational studies to understand the developmental trajectories of children in lower and middle income countries and identify risk and protective factors that can be used as targets for interventions. My dedication to a career in global early childhood development and early childhood mental health has evolved from my experience both training and working as a physician in resource-poor settings, the awareness that early intervention and prevention are cost-effective approaches, the knowledge that the early years are a period of maximum brain growth and the formation of emotion regulation patterns that are linked to future physical and mental health outcomes, and the awareness that there are differing trajectories of brain and behavioral development as a function of exposure to risk and protective factors. I would argue that child survival and child development are inseparable. 90% of children live in low and middle income countries. Enhancing their cognitive, socio-emotional, and physical potential is in the world's best interest. As Nelson Mandela once said, "Our children are the rock on which our future will be built, our greatest asset as a nation. They will be the leaders of our country, the creators of our national wealth, and those who care for and protect our people." That's all I have. So I'm working on a study that is based in a community outside Durban in KwaZulu-Natal, South Africa. It's a study on autism, and we are validating both screening and gold standard diagnostic tools for Zulu children. It's only 4 months in, so I don't have data. It's mainly around validation of the tools.
Questions for the comments?
So South Africa is a very diverse society for many complex political and social reasons. I think within the Zulu community, which is particularly the community we're working in, there's very little understanding. Very few children have been identified, very few, even less are receiving services. And from the focus groups that have been done, you know, children with social and communication disorders aren't necessarily seen as disabled. You know, the real impact of their disability will only become evident when they grow up and they cannot contribute financially to the household income. So, you know, thinking through how to reframe that, you know, in and of itself is a huge challenge. Sure. So, you know, the first step of validating a tool is doing it on kids from the same culture who don't have the disorder. So the group I'm working with has just completed an NIH study of children with developmental disabilities in a time of HIV. So it's easy to recruit, you know, from that sample, children that we know do not have autism. The children with autism, we are primarily recruiting from special schools, but you know, most of these children have little, if any, speech, and autism being a disorder which is a spectrum. I think we're going to have significant difficulty finding autistic Zulu kids who are higher functioning, and that's sort of a function of, you know, lack of identification. And also lack of services, so, you know, to enhance the capacity that the child does have to gain, you know, better communication skills.